of all repro topics, right? It's the happy, normal foaling when we get new little horses on the ground. So without much further ado, I am going to, for a fun fact, we're going to note the time, and I'm starting at 8:48, so just keep that in mind. Okay. So what we want is to get from that little black square there, black circle, to that happy newborn foal chilling out with its mom. And that process takes about 340 days. Now it can have a range of about 20 days on either side and still be considered normal. So you go before 320 days and the foal tends to be a little bit premature. After 360 days, starts to get a little bit long and we all get a little bit nervous, right? But unlike some of our other species where we would induce a mare or induce a cow or whatnot, if we thought it was carrying a little too long, we never induce a mare without really consulting and thinking about it. And the reason is that foal does a ton of growth at the end of its gestation period. And if you induce a mare too early, you might actually get an undermature foal. So that's something to keep in mind, is we have to wait for that little foal to be finished baking before it comes out. Now, factors that can make the season go a little bit longer or a little bit shorter, the season that the mare is going to foal out can add a couple of days on either side. The sex of the foal, colts take a little bit longer to cook than fillies. Mare nutrition and how much energy and protein in her diet can have an effect. And certain toxins can change a gestation length as well. So one common one that we hear about is fescue toxicity, which can actually add quite a bit of time, up to 10 or more days to a gestation period. So how do we know that the big event's going to happen? So one thing we'll start to see is that the abdomen of the mare will drop and it'll move farther back. And we can start to see that a month, 2 months out as the foal repositions itself, getting ready to be born. We'll see some perineal relaxation. So the foal, in a really cool matter of physiology, actually produces a hormone called relaxin. And it causes all the tissue around the tail head and around the vulva to relax, preparing for the foal to happen. So you'll see us sometimes tap at the tail head and around the bum, and that's what we're seeing, is she softening and relaxing, getting ready for foaling. Another thing we might notice is waxing, which we'll see is a really great picture from a colleague that used to be at Illinois, Dr. Robin Ellerbrook. That's a great picture of waxing. Now, that can happen. Old thought used to be 48 hours, she's going to wax and she's going to foal. We've seen that not all mares read the textbook. It's going to be an ongoing theme in this talk. So sometimes it can happen 1 to 2 weeks out. Sometimes it happens a couple days ahead. Sometimes it happens the night of. Sometimes it doesn't happen at all. But it is a sign that we're getting closer. And then the sign I love is the restlessness and the vulvar elongation. So right before the mare foals, the vulva is going to lengthen in preparation for that foal coming out. And you're going to see her be restless. And so this is going to be a really odd question I have with owners as they're getting ready for their mare to foal. I'll be like, how does your mare poop in her stall? Does she do one pile? Is she always in the same corner? And then one day you're going to call me and you're like, she has 20 piles scattered throughout her stall and she's churning it and her tail's swishing. That's actually a really good indication that foaling's pretty imminent. Now, if you want to get more scientific, there are different ways to test as well. So the secretions in the milk actually change as we get closer to foaling. And all the electrolytes and chemicals, so the sodium and the potassium and the calcium, change as we get closer and closer to foaling. Theoretically, you can test this with a bunch of really cool kits. So on the far right of that screen, you're going to see those 2 test vials, and one is blue and one is pink. And what that tests there, it's called a Foal Watch kit. And what we've done is we've stripped out a little bit of milk secretion and added it very carefully to a vial, and we do a little chemical reaction, just like you did in high school chem, and you switch it back and forth, and it lets you know how much calcium was in that secretion. And we're looking from that change from pink to blue. Now, theoretically, when a mare hits 200 parts per million of calcium, she has a 50% chance that she is going to foal within 24 hours. Once that parts per million gets up to 300 or 500, foaling's pretty much imminent at that point. Now, that being said, not all of them read the book. And there are many nights when you hit 250 and you go, it's going to happen, and then 3 days later it still hasn't foaled out. But the good news is that very rarely, when they're less than 200 parts per million, will they foal out in a 24-hour period. Again, word of caution, your maiden mares don't care. Your maiden mares don't care what the textbook said, don't care what part per million at, and what can sometimes be more important is the gradual trend or the sharp trend. So if your mare went from being less than 50 parts per million to being 175 in one day, that's a pretty good indication that something's cooking and moving along and progressing. There's another version of that test called a predictive foal, which some people might have seen, which is a series of little squares on what looks like a pH strip, and you just dip it in the milk. Same theory, you're looking for the number of squares that have changed color to give you an indication of how soon the mare is going to foal. Now, the pH should also drop, and there was a lot of really good work done by Dr. Igor Caniso and Dr. Robin Ellerbrook out of Illinois on pH drop. And what they said, I'm going to get their exact numbers right here. When Dr. Caniso saw mares, the milk secretion changed from normal as 8 to 8.5 to less than 7, 11 out of 14 mares foaled. What Dr. Ellenbrock said was when they hit 6.4 on their pH, 97% of them foal in less than 72 hours. Really great numbers. Really wonderful. Wish I could get it to work. So I've had 2 problems with the pH. I'm just going to be really honest with you guys and have an open discussion. So one problem with pH strips that I've found is sometimes yellow and shades of green look darn similar. And you're going, is that a 7.2 green or a 6.8 green? And it can be very difficult to read. And everybody sees those shades of color differently. So an interesting project that happened at Colorado State when I was a resident is we would lock each other in the room and everyone would dip the pH strip in the same cup of milk and we all got different answers. So, note of wisdom, it can work. pH meter is fabulous. If you can actually get a quantitative pH meter, great. I think the trend there is still really noticeable. So if you're having a mare hit 8 every night and then all of a sudden she's at 6.2, yeah, I would trust that. Your mare's probably pretty imminent to foaling. But again, it's one of those things, really great science, and they did get it very repeatable, and they did get it to work. I just haven't been as successful, and I think some of my colleagues have probably also been frustrated with both the milk calcium and the pH, in that some mares just don't read the book. And then the thing that I find the most reliable is actually the consistency and the color of the secretions. So in that yellow cup at the top, you almost can't see the secretions, right? Believe it or not, there's some tiny yellow thin droplets in there. Not very impressive. When she goes to foal, most mares, again, not all, but most mares, you're going to suddenly go and get that secretion, and it's going to come out a thick, creamy, yellow-green honey milkshake color. That's what we're starting to see, that colostrum getting ready to go. That's a great sign that she's getting ready to foal. So those are all things to take a look at. So we think she's going to foal. What do we do? If you remember nothing else from this talk, if she has a caslican or somebody sutured her vulva together to try to prevent infection from climbing up her uterus, please remember to have somebody cut out that caslic scar prior to foaling. And we want to do it 1 to 2 weeks out. And the reason is, if that scar is still there when baby tries to come out, baby's foot and head can actually get deflected upwards because of that scar and cause massive trauma to the perineal region and the rectum of the mare. So please remember to take out your caslics. Once we've done that, we're going to make sure we have a nice big stall ready. So, or a clean area if you're foaling outside. Whatever you can do should be protected, shelter. The bigger area, the better. I promise you that she'll find the most inconvenient place to foal in that area, either up against a waterer or stuck in a corner, but the nice big space that you can get. That's one of our foaling stalls, which is fabulous. It's huge. There's more than enough room for the mare, the foal, me, our attendants, and we actually have cameras under ours as well so that we can have plenty of observation going on with the mares. So that's something to consider. How are you going to monitor your mares? Is some poor person going to be up checking on them all throughout the night? Looking at you. How are we going to make sure that those mares are observed and they're in a safe spot? So that's something to think out ahead of time. Bedding them with straw is really nice. You don't have to bed her with straw the whole time, but if you see her getting close, putting out a nice clean straw for when she foals is great, and then you can clean that straw out. It absorbs a lot of the fluid. It provides a clean surface for that baby to enter the world on. We're going to have our cameras on. We're going to put in our foal alerts. So Who's seen a foal alert? A couple people. All right, who's seen a window burglar alarm? Somebody's seen, okay, a couple more. Same theory. So that little blue box is a transponder, okay? And it's going to send a radio frequency when signaled. That little white string is connected to a magnet. So the magnet gets sutured in on one side of the vulva via the string. Transponder gets sutured in on the other. When the pressure of the kiddo coming out causes those two to separate, the transponder sends a radio frequency, sets up an alarm, wakes up the staff. You can go and attend the foaling. You can also program some of these to automatically dial 4 phone numbers. So that can be really nice. Check to make sure that system works. You have it plugged into a hardline phone. Automatically dials 4 people with a message you can record yourself, which can range from hilarious to angry and waking you up at 2 a.m. That's all up to you. But it's a really handy device. We put them in all the mares that foal out at Burwash. As soon as they either hit that 200 part per million or their due date, they get one of these, so that we know that their foalings are going to be attending. So, we think it's time. The tail's wrapped, we're getting ready for foaling. Stage 1 of labor, there's going to be 3 stages. Stage 1 is the restless period. This can be anywhere up to 12 hours. Might see her get a little antsy. She might churn up that manure like we talked about. Can look a lot like colic. So if your mare's sitting there, she's getting sweaty, going up and down, looking at her sides, that can all be signs of stage 1 labor. And that usually leads up to a night foaling. So, got the exact number here. Yeah, 73% of mares like to foal between 10 p.m. and 2 a.m. They love it because the way foaling works, kiddo chooses the day by how big the kiddo has gotten, using up its resources, reaching a certain level of stress inside the mare. Mare gets to pick the hour. So the quieter and calmer the environment, the more likely she is to foal during that time. So that's why most foalings happen at night. And I will again say, some of your more experienced mares are going to toss this out the window and they're going to be eating hay until the moment they decide to foal, and they're going to lay down, foal, stand back up and eat hay. So all of this is with a grain of salt. Okay. So stage 2 labor begins when the water breaks. So what happens is inside the uterus, there are multiple membranes surrounding the foal. And the outermost one is called the chorioallantois. And it's the rupturing of the chorioallantois that lets out the fluid that we call water breaking. That's the signal that stage 2 labor has begun. On average, stage 2 labor in the horse is 17 minutes long. So by the time the water breaks to the time the foal is out, should only be about 17, 20 minutes. Why is that so important? Because for every 10 minutes, over 30 minutes of stage 2 labor, there is an increase by 10% that the foal is going to be born dead. So it is a quick and explosive process in the mare, and that's why we have to note time, we have to be aware of when things are happening, and we have to intervene a whole lot quicker than, say, when your cow is giving birth, right? So it's a quick, explosive process, and we need to be there and knowing what's normal and how to help her. So in a normal stage 2, that water's going to break. She'll probably lie down at that point, and you'll see in a normal foaling a pearly membrane show up. And that pearly membrane is going to have one foot, and then another foot, and then the nose there. And it's going to come out in that staggered position, kind of come out in a curve. Foal's going to pop out. Once the shoulders are out, most of the foal just follows. Okay? And that would be a lovely, happy stage 2 labor. That guy's just finishing right there. Somebody's already broken the amnion, that pearly translucent membrane off of the foal. Mom's still pushing out the back legs. So once kiddo's on the ground, we can breathe a huge sigh of relief, but we're still not done. So stage 3 of labor is the expulsion of the fetal membranes or the placenta. And this is a hugely important step that we all have to take a deep breath and remember to check for, because the foal's super cute and exciting, and this part's kind of gross and disturbing, but it's super important. So the placenta needs to be out within 3 hours. Any time over 3 hours, we consider it retained. And when you check for it, And you should check for it every time. If you feel skilled enough to look at it, absolutely look at it yourself. If you don't, put it in a sealed plastic bag or a plastic container so your vet can check it over. Don't add anything to it. We don't care if it smells. We just want to be able to see it in its entirety. And we're going to lay it out in either that F shape or that Y shape. And what we're checking is that both uterine horns and the uterine body are complete. Because any little tiny portion of that gets stuck in the mare acts as a nidus for bacterial infection. And that bacterial infection can cause a very bad metritis or uterine infection, and it can also cause systemic endotoxemia and a fatal laminitis. So we need to make sure that placenta comes out in its entirety, and if it's not, we need to take corrective action. We can also look at the placenta and see for signs of infection. Did the foal come out with a cervical star? Is there thickening or goo on it? Those can all be signs of a uterine infection that could potentially put the foal at risk that we need to treat. So we have our 1, 2, third stage of labor, and now we're going to have our 1, 2, 3 rule of happy foals. So this is a group of vet students from my residency with my resident mate checking over a mare and foal. Super part of a foaling is to make sure that your foal hits its landmarks. So the 1, 2, 3 rule. It should stand in 1 hour, it should nurse in 2 hours, and third's kind of give and take. Placenta should be passed in 3 hours, and it should pass its meconium. Now, most horses are going to hit these landmarks before this. So most horses stand in 45 to 50 minutes. They're actually sternal at 1 to 5. Horses are quick little buggers. They learn fast. Most of them will nurse in 2 hours. For both of those phases, fillies tend to be a little bit faster than colts. Figure it out. And then the meconium actually usually gets passed in about a half an hour. So if it hasn't passed by 3 hours, we've definitely got some issues to think about and to talk about, whether that's applying an enema, making sure the foal's not straining, things like that. But these landmarks are super important to pass, and they've shown that if the foals don't hit that stage 1 or that stage 2 landmark, they're actually more at risk for as they continue to develop of infections and other issues. So we really need to make sure that we're hitting those landmarks. So we've been born, we've checked it out, foal's doing everything great. As soon as that foal hits the ground, you're going to check off the amnion, make sure it can breathe. The other thing is when the mare stands up, the umbilical cord between the foal and the mare should snap. We're talking about happy foaling, so in this case it snapped. So mare stood up, that umbilical cord snapped. You're doing yourself and that foal a great favor if you start dipping it with diluted chlorhexidine or some kind of disinfectant. Some people like to use iodine. What I would caution you is that if it's too high of a percentage of a tincture of iodine, you can actually burn the foal's skin. So a nice dilute disinfectant, you're just going to take, I have just a 50 ml conical tube in there, shove the whole umbilical stump in there, give it a good swish and soak it. That's going to be really bloody the first time you do it, because I mean we're going to be in there right as that cord snaps. And then we're going to continue to do it 2 to 3 times a day for the first 2 to 3 days of life. What's great about that is it's a great way of reducing the risk of ascending infections into your foal. So really proactive management of the umbilical stump can really prevent sepsis happening in your foal. So, this is a happy picture. This is a picture of a foal, went through its 1, 2, 3 stage of labor, went through its 1, 2, 3 rule, made everything happy, hiding behind mom. And now we need to do the normal post-foaling exam, okay? So this exam goes from the tip of the nose to the tip of the tail, and we don't miss anything in between. We want to make sure that the eyes look okay, eyelashes aren't curled under, gums look good, good swallowing reflex, limbs are straight, no rib fractures, umbilicus is dry and small. All of those things are going to get examined in this exam. And what's important is that we also don't forget mom. So we're going to check foal and we're going to check mom. Make sure that she's not having any post-foaling colic, that she doesn't have any tears in her vulva region. Make sure that she's happy and good to go. She's producing good milk. All of those things are to check. And when I say producing good milk, we want to make sure she's got colostrum, which is the liquid gold of the horse world. If you didn't know it, you know it now. And the reason is the foal is relatively born without any antibodies. So it's going to take a couple weeks to really build its own immune system. And because of the way the placenta is in the mare, it didn't really get those in utero. So it needs to absorb those by drinking this colostrum out of the mare. And colostrum, the mare starts making 2 to 3 weeks prior to foaling. She starts sequestering antibodies into her milk. That's why, if you remember in Dr. Reed's talk, he said that you were going to vaccinate your pregnant mare 4 to 6 weeks beforehand. It's so she can produce those antibodies and put them in the milk for the kiddo, right? So we're going to vaccinate the mare. She's going to put those antibodies in her milk. Kiddo has to eat them. That's one of the reasons we need to hit that 2-hour rule of nursing. It needs to get about 1 to 2 liters of good colostrum so that it can get those antibodies, produce its own immunity. The cells that are going to absorb the antibodies in the intestine, they go away starting at 12 hours and they're gone by 24. So we need to make sure that foal is strong in nursing right away, and it continues to do so as it develops. So how do we know if the colostrum's any good? So, like I said, the foal needs to absorb the antibodies in the colostrum in the first 24 hours. And what we might do at the foal exam is something called a snap test. So we're going to take some blood, and on that far right, you're going to see that little 3 dots. Those 3 dots are something you're going to stare really hard at for 7 minutes, because that's going to let you know if there was adequate passive transfer or adequate absorption across the intestine that your foal needs for its immunity. If it hasn't reached an adequate level, we can supplement it and we can fix it. So if it's less than 24 hours and those cells are still available, we can use a frozen colostrum or a colostrum supplement via a nasogastric tube and give it orally. If it's after 24 hours, those cells are gone. So that's why we need to do the plasma transfusions that you'll sometimes see to help boost the foal's immunity. Now, a really cool thing we can do, and we do at our foalings at Burwash as well, is this little device. It's actually from the wine industry. It's called a Brix refractometer, and so ignore that part on the right that says approximate value degree of alcohol, because that's not for us. What we're looking at is that thing called the Brix percent on the left. Now, studies have shown that the Brix percent is actually correlated with how awesome the colostrum is. Those weren't the words they used in the paper, but that's kind of the gist. So I have it divided into those little brackets. Anything 30% and above is like a high octane colostrum. Has a lot of good things in it, most likely going to result in an adequate passive transfer. 20 to 30, still good. 15 to 20, you're getting in the fair range, and less than that, it's poor. So what's great is at the time of foaling, kiddo's still on the ground, mom's not really paying attention yet, she's still a little doozy. Take 1 little drop of her colostrum, put it on there. This is all water on this test slide. When I add a drop of secretions, there will be a white-blue line interface. And I can tell right away, ooh, maybe she leaked her colostrum, and we didn't notice. She's only at 10%. I know that that foal needs supplementation now, because it's probably not going to reach adequate transfer on its own by 24 hours. So it's a nifty little device to have on hand. So, in summary, preparation is the key to happy foaling. So know if your mare has a caslick, make sure you've got a stall set up, have an emergency protocol. It's a quick, explosive process. So it's only 17 minutes long, and if I check the clock, a foal should have been born in the time it took to give this talk, right? That's why I looked at the time. So that's why it's important to check your watch and make sure you know your landmarks so you know when what seems long is actually turned into too long. Know what is normal. Know what you're looking for. We know that we should see a pearly translucent membrane. So if we see a dark red membrane, that's not normal. We need to take action right now or seek veterinary advice. And if you're not sure, ask. That's why our team is here. We're here to support you and answer your questions. And we'd rather get a call about a question and say, oh, normal, don't worry about it, than to have somebody hesitate because they feel awkward asking and lose those precious minutes that really add up to having a healthy born foal. And so I love this photo. This is a foal from this past breeding season. I love it when foals are feisty and angry and they're trying to double barrel me and they're running around the stall because that means it's a healthy, feisty foal. They should be blurry in all photographs, right? So that's what we want. If they're all cute and quiet and lying down and you poke them and they're not doing anything, that makes me worried. We want these happy, feisty guys. So that was a normal foaling in the time of a normal foaling. And if you guys have any questions, I'd be happy to answer.